I think it's something that is becoming more and more important. For example, when you talk about MDS, in many countries actually across the world, they don't even have access to hypomethylating agents, which are drugs that have been shown to improve outcomes in patients with higher risk MDS. But in many countries, those drugs are expensive, and many of those patients just get treated with supportive care, and that of course leads to worse outcomes and more limited survival and worse quality of life, etc. And now that we are entering into an era in the Western world where not only we are using hypomethylating agents, but we are combining these drugs with other active agents such as venetoclax, and in clinical research a number of other agents are being combined, such as IDH inhibitors and the sabatolimab and magrolimab and pivonidistat, all of those. And I think as some of those agents start being used, if they get approved, it would be an important help for patients here in the Western world. But the struggling resource-limited countries, I think, are going to continue to have a problem in terms of how they can obtain these agents. It's always sad to me that when they are active agents, but a patient cannot access that. And in many of the resource-limited countries, many patients who are older might not get even treated. And in MDS and AML, the median age at diagnosis is in the late 60s or early 70s. So many of those patients might not even receive any therapy. So I think there has to be a collaborative work between regulators, but also I think there have to be a push from the scientific community with our pharma partners, basically, to work on ways in which those agents can be made available at reduced prices in the rest of the world. I think in some ways similar to how the HIV pandemic has been managed, where many of those HIV medications were initially very expensive, and ultimately strategies were developed so that they become available in the rest of the world, especially in areas where it could be most effective and most needed, in poor areas where there's a lot of prevalence of HIV. I think a similar situation can be handled the same way, basically, with myeloid malignancies, where a strategy to use some of those agents in the rest of the world. So I think ultimately that is the direction that things have to take in, especially as we continue to introduce more and more of those agents, and to understand how we can choose cost-effective therapies, I think will be also important both here in the West and the East.